Ntando. Shadrack Sibisi is the chairperson of SATTA. He joins us now. It was supposed to be via Skype, but we're going to do it telephonically. A very good morning to you. You say the lockdown shouldn't be an experiment in getting people to quit. Is this not an irresponsible call, considering COVID-19 presents in the form of respiratory complications? And smoking is one of the known culprits for respiratory problems. Why did you feel pressed to make this call?
Thank you so much for having me. I think one needs to understand that in South Africa, we're a democratic country, whereby in the statute there is nowhere that says smoking is a crime. If it stands like that, I would understand. But at the moment, smoking is illegal in South Africa. So if you punish people for mere taking what they feel is a necessity on their part, it's unfortunate.
How do you want government to review the regulations?
To make things worse is that if you ban people from buying cigarettes, doesn't mean they stop smoking. They go to illicit market. As I'm speaking, people are smoking. It's not that they don't smoke, but they smoke as criminals now.
Yeah.
Because they smoke something that they are doing it illegally.
Mr. Sibisi, illicit trade in the sector is already an existing problem. Why do you think it will be exacerbated by these regulations?
Now, if you don't sell the legal cigarette, what do you mean? You mean now that now it's free for all on the illicit?
Is that what you mean?
I'm meaning when in these 21 days whereby you cannot go to a shop and be able to buy cigarette because of the ban. That doesn't mean the illicit market have stopped as well. They are smoking, they are using the tobacco, which it impacts negatively on the South African economy because they don't pay taxes. The legal one do pay taxes. Million rand is going to go, billion rand is going to go under the drain now if we don't sell.
So how are you interacting with government as you make this call for a review of the regulations?
We did wrote to the Minister of Trade and Industry as well as the Minister of Agriculture on the 26th, because they, in essence, ban everything that goes with tobacco. But we are in the middle of harvesting, of which they did turn around in a good way because they allowed us to reap our leaf, which is fortunate, and we are helpful for that. Okay. But when it comes to not be able to sell cigarettes, the 11 million people that are smokers, they go to the illicit. It doesn't add up correctly because if you go to the shop to buy essential services, you can drop a packet of cigarettes in your basket. You don't add numbers. Oh. So to infect people, you see. So to me, it doesn't make any sense at all.
Thanks
except that it kills the economy. You remember, now we are at junk status. But now, if you lose 1 million with thoughtful decision, it's unfortunate.
Sorry, thanks for clarifying that. The statement had said 1.1 million, so it's 11 million smokers in the country.
Yes, yes.
You say in the statement that point-of-sale regulations are already tough enough on the sector, and you think they are sufficient and there's no need for further regulating.
If you think economically, that's a fact. It's already regulated enough. There's no need to go beyond what's happening at the moment. But as much as that might be, we were welcome whatsoever they have said so far. But then to punish people for 21 days, it's unfortunate because now these people, they are smoking illicitly.
Mr. Sibisi, as you fight for smokers, how are you also educating the very smokers about the dangers of smoking at this time, especially in relation to some of the facts that smoking is usually combined with drinking, and it could be problematic for control during this fight against COVID-19?
You need to look at this in this way. As much as smoking is not a good thing, but you don't have to think of smoking only in the form of smoking. Smoking brings economical benefit to the country. If you can add the numbers and see how much it puts on the coffers of the receipt of revenue, it adds more value than the other stuff. Because remember, smoking goes with food security, which comes as an incentive.
Really?
It creates jobs. So to me, as much as I understand that people need to cut less in smoking, that's fine. That's perfect. But while that is illegal in South Africa, people need not to be punished.
Yeah. You represent farmers, workers, processors, manufacturers, and other parties across the local value chain in the tobacco space. It's very rare that you find an organization that represents both sides, the employer and the employee. How do you clarify your message in terms of what your mandate is?
I think this is very simple because it was not an easy decision for one to take because it needed to thoroughly engage with all the different stakeholders. And remember, if we are in a mutual organization like this one of ours, it means everything that goes has got to the humanity face because we are looking after the population in the correct way. So to say now, before this thing of sanitizer that is now in the rush, in the tobacco industry, that's the first thing that we need to provide to the workers. Anyone that is involved in the tobacco industry knows the rules and regulations. Health is the prime factor. And now, remember, when we talk of smoking cigarettes, there's what we call the Sun-Cued Virginia tobacco. It's a leaf that we produce now, the 155 emerging tobacco farmers. That's a filler tobacco that's blended into the fluid. It's less in nicotine content. It means now we have been trying everything possible to make sure that we reduce the danger of smoking. As much as it's not that enough, but the researches are being carried through to make this thing better. As I'm speaking, that's why I speak very hard on the illicit, because I know those are not regulated.
Yeah.
So we are not just saying people may need to smoke willy-nilly. We are trying everything possible to assist to cut down on the level of nicotine.
Are you able to give us numbers in terms of the impact of COVID-19 and the lockdown on the sector?
Yes, to be specific, R1 million goes to the receipt of revenue per month from the cigarette sector. Then it's out. Now the workers were supposed not to have worked for 21 days, but at least the government come to its senses, then they agreed the people are working, but they are safe there because they are being looked after. It means now their income is intact. Remember, this industry has got 8,000 workers, of which the 8,000 workers, when you add the numbers of benefits, it goes to 30,000. So it's not just a minor economical VAT, it's a huge one.
So let's just clarify, you're the chairperson of SATTA, but you're also a farmer in the space, aren't you?
Yes, I'm a farmer myself, yes.
Okay. Well, perhaps another time we can talk about other issues within this industry. But for now, thank you so much. The chairperson of SATTA, Mr. Ntando, Shadrack Sibisi, talking to us there on the line with the call they're making to government to soften up the regulations around smoking.